Hello, everybody. My name is Ronnie Engel, and this is my presentation on the paper I'm doing about drug decriminalization, and this is a cross-cultural review. So I decided to do this study because I wanted to learn more about what decriminalization policy is actually doing, rather than what it's intended to do. I want to compare it to different parts of the world, specifically Portugal and Canada. And I kind of wanted to see what the opinions are on decriminalization and legalization. So there's an important distinction to be made between those two things. When we talk about decriminalization, it's not making something legal. It's taking away the harsher punitive aspects of drug offenses and drug charges. So lower level offenders who are nonviolent, that have an amount of whatever substance that does not indicate that they are intending to sell it, will usually be subject to more civil charges like fines, and they will be directed towards treatment and educational services. And if people do decide to seek treatment, in most cases, their fines are reduced. And with legalization, usually we think about alcohol. So there are specific parameters in which someone must use this substance in order for it to be legal, but it is widely available to the public. People over the age of 21 is an example with alcohol. And with alcohol, the people who sell it and produce it are limited. The people who consume it are limited. The times in which it may be sold are limited. Things of this nature. It's controlled. But if you use it within these parameters, you cannot be charged. Unless you are disorderly in public, causing a scene. So next we'll look at the history of different countries who have decided to decriminalize substances. And a lot of it has to do with public health. When people decriminalize something, there's usually a public health crisis that has been ignored because of political, racial connotations. And this decriminalization process kind of started in the late 70s in Portugal. And lawmakers changed the way that substance abuse was viewed and described. So it's not an issue which requires someone to be locked up. It's something that really needs rehabilitation, treatment, behavioral treatment as well from professionals. And then in 1999 through 2001, policy was put together. They strategized ways in which they could mitigate the public health crisis that was HIV and AIDS. And just trying to make the streets safer and reducing the amount of deaths from these complications. So a very important part of this was treatment being more widely available and more comprehensive and better funded and things of that nature. And then we saw that in 2008, they recriminalized a certain amount. Like we see in Oregon where Measure 110 kind of decriminalize amount up to a certain point. That's what we see. Portugal in 2008, they put a 10-day use rule. You cannot have substances that can be used over a 10-day period, or else you are subject to jail. In Canada, they haven't really implemented too much decriminalization policy, but they will start to do so next year. And this all started with needle exchange. People were dying of AIDS, dying of hepatitis. It was, again, a public health crisis in the 70s and 80s and needed to be mitigated. So they decided that clean needle exchanges were the way to go. And then coalitions were made of people who wanted better drug policy, and new drug policy was drafted. And Canada finally sanctioned a safe injection facility in 2003 in Vancouver. So this means that it's protected, it's funded by the government. And then we saw that Canada became a little more innovative with how they dealt with the heroin crisis. They assisted people in sites it was called an insight facility, where they would be monitored while they were using to make sure that overdose didn't happen. And then we discussed the trial starting of decriminalization of MDMA, meth, cocaine, and cannabis. And then finally, state history. We've kind of struggled going back and forth from decriminalization to recriminalization. We almost got there at one point with Jimmy Carter on a federal level, but that didn't quite work out. But in 73, Oregon was the first state to decriminalize possession of cannabis that was under 1 ounce. So they laid the groundwork for 27 more states to pass legislation of this nature, to pass drug policy that would decriminalize cannabis. And then this led to Colorado being the first state to decriminalize a non-cannabinoid. They made psilocybin, they decriminalized it, and they made it legal for therapeutic and medical reasons. And very recently, 2019. And then we see the latest policy. Oregon decided to decriminalize all drugs. A certain amount will not land you a jail sentence, and instead will divert you to treatment options and a possible fine. And this happened in 2020. So these are the papers that I analyzed. I found some very interesting statistics. Arnold, he was a student at University of Michigan. He went to Portugal, and along with his studies about how decriminalization has helped the people of Portugal over the past 20 years, he found that people were not more likely to start using and abusing substances just because criminalization has occurred. And the vast majority of people in Portugal know exactly where to go if they need to get help for a family member, a friend, or themselves. And he also detailed that we saw a reduction in overdose-related deaths and transmission of HIV, as well as hepatitis. And the death rate continues to be a very low figure. 6 in every million people die of overdose-related deaths, which is very low for Western Europe, much lower than other places in that region. And similarly, in this next study by Netherlands, we review how drug policy has affected people, and we see that the amount of people who use and are high risk users, the amount of adults, has remained the same. But we did see that youth declined in their use of cannabis. And then we saw a rise in arrests, in fines, after 2008, when the 10-day use rule was established. And the next study by Hammond, we review an interview study of over 500 people. This took place in the United States, and it was found that while cannabis users were for legalization and decriminalization of cannabis, a lower level drug, more high risk users of cocaine and opiates were pretty neutral. They didn't really care whether decriminalization or legalization happened. They were neutral. And then we virus by MTS that as overdose related deaths rise, so does the duration of the pandemic. And this has severe mental health implications. This calls for a very important time where redesign of behavioral and public health is crucial to save lives. Next was, I'll skip to the final piece of literature. It was a review on policy implications. It's very, very important that this new measure 110, is reviewed in a way that is all-encompassing, something that legitimately details how legislator is affecting people on the ground in real world, and not just what the intended impact is. Are more people getting treatment? Are less people dying? Is HIV and hepatitis becoming spread less? All of these things. And we saw that on the onset of this this measure, there was supposed to be $300 million in funding towards housing and treatment, behavioral health harm reduction, that facet of help. Adversely, we've seen that mobilization of funds promised by this policy has not yet been administered, and it's in the final stages of review as of this month. So this funding is supposed to go out very soon, but it's been more than a year and no funding has come about, or at least not the promised funding. And this is a problem. We can't really evaluate how this policy is affecting people um, realistically, because not every aspect of it has been deployed yet. And Portugal's policy, I feel like it's still shaping itself. It's Even though the last update was in 2008, there is still much more research to be done um, in how drug decriminalization is really affecting people. However, we are seeing reduction in disease and in deaths. In Canada, we we have seen that they have made many initiatives to begin um, reducing the harms of substance abuse. They are also, like Portugal and America, seeing substance abuse as something that needs treatment, it needs funding, they need to fund harm reduction sites, and I look forward to seeing how this plays out. So, analyzing the very similar histories and opinions of decriminalization, we kind of see that people are not more likely to want to try substances just because they are decriminalized. And decriminalization that has been implemented for a long period of time, such as in a place like Portugal, has seen a reduction in deaths and more people being able to seek treatment, knowing where to go, and having options. And the reason why the rate of high risk drug users is remaining the way that it is because decriminalization policy is not meant to take those people off the streets, to take those people away from society. It is meant to help them, to treat them, to keep them alive, pretty much. And here we conclude. Measure 110 could save hundreds, thousands of lives, but we need more time to see how funding plays a part in this. And we see a lot of similarities in Portugal and the United States and Canada as well. I definitely saw implications of policy and the political climate around talking about drugs is it's stigmatized. It has racial undertones, and the current policy in the majority of places does more harm than good, because it doesn't focus on the public health aspect of substance abuse, only punitive measures. It funds punitive measures. So hopefully we will see more policy like that in Portugal, because it seems to be working. And as Canada inches towards change, they are being supported. Justin Trudeau, which is the Prime Minister of Canada, is progressive. He is a supporter of this. So hopefully we will see not just a 3-year trial, but more to come after that as well. References. And we discuss in the future. There's a lot of unknowns. There's a lot of what ifs. There's a lot to be learned from policy, as we've seen in the review of this paper. Some very important things must be done in order to properly evaluate drug policy in Oregon, especially. And we need a more cohesive implementation. We need more support, more governmental support, less bureaucratic involvement, and something that is meant to save lives and mitigate a crisis. So that is my presentation. Thank you guys for watching. Have a great summer, everybody.